Once it does, you've reached stage 2. At this stage, often you still won't feel sensitivity. This is the second best time to fix it. We place a larger and deeper filling. The greater percentage of your tooth that must be replaced by filling material, the weaker it gets. These weakened teeth are more vulnerable to cracks, infections, or fractures. To minimize the potential for these complications, it's often wise to upgrade to a full coverage crown when you have a very large filling. The deeper the filling, the closer it is to the tooth's nerves, which are located in the pulp. As a result of that proximity, the pulp may become irritated or inflamed, and that's why there's a greater chance of prolonged sensitivity after a deeper filling is placed. A cold drink could remind you it's there. Of course, as stated earlier, the tooth probably didn't hurt at all before the filling was placed. Fortunately for us dentists, most patients understand, but not everyone. Most of these super sensitive teeth will get better in time, but sometimes they don't. Sometimes they descend into a full-blown toothache, and in that case, the tooth will need the same treatment as a stage 3 cavity. Here's a real-life example of a stage 2 cavity. Here's a real-life example of a stage 2 cavity. In this case, we placed a very deep filling, and so far so good for this patient. Hopefully we caught the cavity in stage 2, because once we've reached a stage 3 cavity, the tooth needs a root canal. And that's because the decay has actually reached the pulp of the tooth. At this stage, believe it or not, most of the time there is still no pain. There may be some sensitivity when you eat something sweet or cold, but not always. However, the tooth is at risk for a toothache. Those excruciating toothaches develop as a result of an infection in the pulp. Interestingly, the bacteria that cause the pulp infection are different than the ones that cause the cavity. But the cavity serves as a huge portal of entry to the pulp for these infectious bacteria. When that will happen is anybody's guess, but please don't wait for it. Once a tooth needs a root canal, it actually needs at least 3 procedures: a root canal, buildup, and a crown. A root canal involves removing the diseased pulp and nerve tissue, then cleaning and shaping that empty canal space, and sealing it off with a rubbery material. Now we need to clean the top part of the tooth and replace the diseased or damaged tooth structure. That takes care of the root, and now we need to clean the top part of the tooth and replace the diseased or damaged tooth. Now we need to clean the top part of the tooth and replace the diseased or damaged tooth structure with a filling. After that's done, the tooth is covered and protected with a crown. After that's done, the structurally weakened tooth is covered and protected with the crown. Here's our real-life example, all repaired. Sometimes we can't tell with certainty whether or not the tooth decay actually reaches the pulp. This is when things can get a little tricky. The proximity of the decay to the pulp, as we can discern from this The proximity of the decay to the pulp, as we can discern from this X-ray, is illustrated with the black and red coloring. As far as we can see on the X-ray, the pulp and the decay are not touching. But in real life, the decay may go a little deeper and the pulp might extend a little higher. X-rays are only so sensitive to pick up those color variations. We hope to resolve the issue with the filling, but once we start removing the decay, we may discover that the decay has reached the pulp. And if so, stage 3 treatment is appropriate. So we have to prepare for either possibility. If you can't get to your cavity by stage 3, it will progress to stage 4. Once the decay progresses too far, we can no longer fix the tooth, and the only option is to remove it. While these hopelessly decayed teeth never hurt badly enough to compel treatment before, they're still vulnerable to a painful infection at any time. They may also develop a chronic painless infection that can create a burden for the body's immune system. Here are remains of teeth that never hurt badly enough to compel treatment. While they're chronically infected in this case, the patient still didn't report any pain. Once again, don't wait for pain. Here's an example of the same tooth 10 months apart. The tooth went from fixable to not fixable, and it had to be removed. Luckily, in this day and age, we do have great ways to replace missing teeth. But oftentimes the tooth replacement will be more expensive than fixing the tooth even with stage 3 treatment, so it's always best to catch the problem as soon as possible. After a dental exam, some of you may discover that you have many cavities to address, cavities in all stages of development. But keep in mind that after you get through that initial phase of treatment, it gets a lot easier. Now that you know you're cavity prone, it's more important than ever to make regular dental visits a part of your life. You can also do your part with good home care and a diet rich in calcium and low in refined sugar. And once again, I can't overstate the importance of dental recall visits. At least once every 6 months. At your recall visits, we can help prevent new cavities with professional cleanings and fluoride application. Any cavities that do arise can be treated more quickly and conservatively. With regular visits, you should not accumulate a laundry list of needs again. An issue may pop up from time to time, but it should be very manageable. I hope it's now crystal clear how staying ahead of cavities will save you a tremendous amount of time, money, and pain over the course of your lifetime. Not to mention, the outcome will be much, much better. Thank you for watching.